Hello, my name's Lindy Royer and I'm a student and client at Swim Labs in Denver, Colorado. I've been going there for a few months now and I've learned a lot and I'm really enjoying myself. I also happen to be a physical therapist and a master Pilates instructor. So I work with injuries and movement education all the time, and I've been doing it all of my adult life. I've discovered some things about myself as I've been attempting to learn to swim and improve my stroke. And as a result, I asked Mike and Gif, the owners at Swim Labs, if I could put just a really short video together and explain some of the things that I've learned and give you a couple of tips and some exercises that you can start to do that will hopefully also improve your stroke technique. Now, there are lots and lots of things that we could talk about, but I asked Mike and Gif the other day what they saw in their clients that they thought would be really helpful for us to put in a quick video. So I listened to them and came up with a couple of things that hopefully will help you. As you know, good stroke technique is critical, and good stroke technique will help you be more efficient, swim faster, and prevent injuries. So I'm hopeful that you're sold on the idea of having good technique. Now, good technique is usually a function of good understanding, for one thing, and it's also a matter of being able to execute the moves that you're being asked to do. So if, for example, you have a stiff or a sore shoulder, it makes it really difficult to be able to get your arm in the water in a really efficient, technical way. Some of the things that we discussed the other day that I'm going to put on this video are the ability of you to be able to move your shoulder blade, number one, and the ability of you to be able to move your thoracic spine or your upper and mid back, number two. I'm going to show you what these things look like, and then I'm going to give you some exercises for them. So the first thing that you should know is that the shoulder blade is really critical for having good shoulder girdle mechanics. Now, there are lots of other things that go into it, and we're not going to cover those here, but just realize that the shoulder blade needs to be able to move in order for you to get your arm up over your head. So let's have a look at what that looks like. So I have a shoulder blade here. This happens to be a right shoulder blade. It's attached to a right collarbone or clavicle and part of a right upper arm bone. So this is the right upper arm or humerus. This is the right scapula or shoulder blade, and this is the right collarbone or clavicle. Just for the sake of being simple today, I want you to imagine that this bone looks like a map of Africa, and that as the arm moves up overhead, the shoulder blade itself has to be able to move. So the shoulder blade moves in a lot of different directions. The one that we're mainly going to focus on today is for the ability of the shoulder blade to slide up and down the rib cage, and to slightly be able to move or pivot or pendulum, if you will, out to the side. So as the arm moves further overhead, we're very dependent on the shoulder blade to be able to move in this direction with the upper arm bone. This is one of the things that prevents you from getting shoulder impingement problems. The second thing that I want you to be aware of is the ability of the thoracic spine or upper and mid back, this outward curve here, to also be able to move. Now, you'll notice just a quick word about spine alignment. We call this a double S curve. So there's a little bit of an inward curve in the lower back, a little bit of an outward curve in the thoracic spine or the middle and upper back, and a little bit of an inward curve in the neck. This is the head up on top, the pelvis underneath. So these are normal spinal curves, but of course the spine moves. You have a stack of vertebrae here, all of which need to be able to move. So again, for just the sake of what we're going to be talking about for our exercises today, we need to be able to move this thoracic spine so it can move into more flexion. Perhaps you've seen people that are actually stuck in this flexed position. That's not very good, particularly for the neck and head or for the lower back. So when these spine joints move in the upper back, they actually slide together. You can imagine them like plates opening and closing, or hinges opening and closing. So this movement is what creates the spine, or allows the spine to be able to move into more of a straight vertical position like this, or a slightly flexed position like this. I don't want you to get the impression that I'm asking you to be able to get this kind of a curve in your mid-back. You can't, it's impossible, and if you tried, you'd do serious damage to yourself, so please don't try that. But what I'm asking you to be able to do, and we'll show you this in an exercise in a few minutes, is to be able to move these spinal joints through the mid and upper back into a more flat or straight position, and into a more flexed or curved position. Let's have a quick look at what all of this looks like put together on a regular skeleton. So here's a picture of the shoulder blade moving lying on the stomach. You're going to be doing this lying on your back. When you lie over onto your back, make sure that the rib cage right under the shoulder blades in the middle of the pelvis are resting on the table or the floor. You're going to take your arm over your head. Don't allow the ribs to completely lift off. You want to have contact just underneath the shoulder blades, and you're simply going to slide the shoulder blade up and down the rib cage, keeping the elbow as straight as possible, so that only the shoulder blade itself is shrugging up toward your ear and unshrugging away from your ear. If you force your lower back down into the table, you're going to find that the shoulder blade doesn't move quite so easily. So notice what happens when the shoulder blade, or when the lower back, is forced down into the table. There's a different quality of movement. Conversely, if the rib cage is too lifted off the table, you'll find that you get a side bending movement, or a bend at the waist, which is going to prevent easy rotation when you're in the water. So simply keeping the back of the ribs and the center of the pelvis with a slight space in the lower back, and sliding the shoulder blade up and down on the rib cage is going to give you the best quality. Here's where the shoulder blades need to be when lying on a half foam roller. You can also use a towel rolled up for this exercise. And here's how you're going to move the upper back, or the thoracic spine. Think of this as lengthening the chest bone and shortening the chest bone. So if you imagine the sternum bone, that big long chest bone, as being made out of plastic, you'll find that you can actually move the upper back more easily over a towel, rolled up towel, or a half foam roller. This is the best way to get upper thoracic movement. Notice that it's not rib cage movement. If you allow the ribs to stick up toward the ceiling, you're not going to get the same quality of movement that we're looking for in the upper back, and this is going to create lower back pain. So the movement comes from the mid and upper back, keeping the ribs and the pelvis connected, if you will, while you move the upper back. Extra bonus is to allow the head to rest down on the floor and reach the arms long, so that you get a nice lat and pec stretch at the end of your movement. So try these exercises, see how you go, and have fun in the pool.